My name is Dr. Lisa Wong, MD, FACS, 22 years in trauma surgery at Metropolitan Trauma Center, board certified in general surgery and surgical critical care. I've seen everything from motorcycle accidents to gunshot wounds, complications that would make medical students faint. But nothing prepared me for patient 12C, admitted on a cold February night in 2023. The ambulance arrived at 11:47 p.m. Male, approximately 60 years old, found unconscious in Washington Park after an apparent cardiac event. No identification, no witnesses. EMTs reported initial asystole, flatline, for approximately 12 minutes before achieving return of spontaneous circulation. By all medical standards, he should have been brain dead from hypoxic injury. Initial assessment revealed profound neurological deficits consistent with anoxic brain injury. Glasgow Coma Scale of 3, the lowest possible score. Pupils fixed and dilated. No response to painful stimuli. I ordered immediate CT scans of his head and torso, standard blood work, and continuous cardiac monitoring. The man was essentially a vegetable. Radiology showed massive cerebral edema, widespread cortical damage consistent with prolonged oxygen deprivation. His brain tissue appeared severely compromised throughout multiple regions responsible for consciousness, memory, and basic motor function. I'd seen similar scans before. Patients who never woke up, who lived on ventilators until families made the difficult decision to withdraw care. We transferred him to the intensive care unit on full life support, mechanical ventilation, central venous pressure monitoring, arterial line for continuous blood pressure measurement. His vital signs remained unstable, blood pressure requiring multiple vasopressor drips, irregular heart rhythm, poor oxygen saturation despite maximum ventilator settings. Medically speaking, his prognosis was grim. I reviewed his case with Dr. Martinez, our chief of neurocritical care. Textbook, anoxic brain injury, he confirmed, studying the imaging. The damage is too extensive. Even if he survives, cognitive function would be minimal at best. We're looking at a persistent vegetative state scenario. I nodded, having reached the same conclusion. On day 3, something unprecedented occurred. While performing my morning rounds, I noticed the patient's eyes tracking my movement across the room. Not random eye movements, purposeful, coordinated tracking. I checked his pupils. They responded normally to light stimulation. His Glasgow Coma Scale had somehow improved to 8 overnight, with no medical intervention. "Good morning," I said tentatively, approaching his bedside. The patient's eyes fixed on mine with unmistakable recognition and intelligence. He attempted to speak around the endotracheal tube, making urgent gesturing motions toward his throat. Against protocol, I decided to assess his ability to breathe independently and began weaning his ventilator support. Within hours, his oxygen saturation stabilized on minimal supplemental oxygen. I consulted with respiratory therapy before making the decision to extubate. As the breathing tube was removed, he coughed weakly, then looked directly at me and spoke in a raspy but clear voice. "Dr. Wong, thank you for not giving up on me." I froze. This homeless, unidentified patient knew my name. More disturbing was his tone, familiar, almost intimate. "How do you know who I am?" I asked, checking his wristband to confirm he remained listed as John Doe. He studied my face for a long moment before responding. "We've worked together before, Lisa. Don't you remember me?" Something about his voice triggered a distant memory, but I couldn't place it. His facial features were weathered, aged beyond his apparent years, with deep lines suggesting a difficult life. Grey hair, unkempt beard, calloused hands. Nothing about his appearance suggested medical training or professional background, yet something felt eerily familiar. "I'm Dr. Robert Martinez," he continued, his voice growing stronger. "We did our residency together at University Hospital. You probably remember me as Bobby." I taught you how to place a central line during our trauma rotation in 2008. You were terrified of puncturing the carotid artery. My blood turned cold. Bobby Martinez had been my closest friend during residency. Brilliant surgeon, incredible teacher, infectious laugh. But Bobby had died in a car accident in 2015. I'd attended his funeral, spoken at the memorial service. This patient was obviously delusional, possibly having accessed my personal information somehow, constructing an elaborate fantasy. Bobby Martinez is dead, I said firmly, maintaining professional composure while my heart raced. I attended his funeral 8 years ago. You're confused, which is common after a severe brain injury. Let me get psychiatry involved to help sort through these memories. I turned to leave, but his next words stopped me cold. You spoke at my memorial service. You told the story about how I saved that kid with the ruptured spleen on Christmas Eve 2009. You were crying so hard you could barely finish the speech. You wore your black dress with the pearl necklace, the one your grandmother left you. Those details were accurate, painfully so. The dress, the necklace, the story I'd shared, all correct. But many people had attended Bobby's memorial service. This information could have come from various sources. I needed to test him with details only Bobby would know, private moments between us that had never been shared publicly. If you're really Bobby Martinez, tell me about the night we spent studying for our surgery boards. What happened in the call room on the 4th floor? I crossed my arms, certain this would expose his deception. No one else knew about that night, our first and only kiss, a moment of vulnerability during residency stress. His eyes softened with genuine emotion. We were reviewing cardiac surgical procedures until 3 a.m. You were exhausted, stressed about failing the exam. I was trying to comfort you, and suddenly we were kissing. Then you pulled away, said it would complicate our friendship. We never talked about it again, but it changed everything between us. The room seemed to spin. Those details were absolutely private, never shared with anyone. Either this was an incredible coincidence, or something impossible was happening. I sat down heavily in the bedside chair, studying his face more carefully. Beneath the weathered features, I began to see familiar bone structure, the same bright blue eyes. This is medically impossible, I whispered, more to myself than to him. Bobby died in 2015. You suffered catastrophic brain damage 3 days ago. There's no way you should even be conscious, let alone retaining detailed memories from decades ago. Brain injury doesn't work like this. He reached for my hand with surprising strength. I know how this sounds, Lisa. I know what the medical evidence says. But I'm here, I'm aware, and I remember everything. Not just about us, but about what happened after I died. It's been complicated on the other side. I pulled my hand away, trying to maintain scientific objectivity. Let me get Dr. Martinez involved. We need comprehensive neurological testing, psychiatric evaluation, possibly genetic testing to determine your actual identity. There has to be a rational explanation for this apparent knowledge of personal details. I stood to leave, but he spoke again. Before you go, check my medical records from residency. I had a distinctive birthmark on my left shoulder, shaped like a crescent moon. Also, I broke my right wrist in 2 places during medical school, skateboarding accident. The X-rays showed a specific fracture pattern that required surgical pins. Against my better judgment, I found myself examining his left shoulder. There, clearly visible beneath the hospital gown, was a crescent-shaped birthmark, approximately 2 inches long. My hands trembled as I ordered X-rays of his right wrist, knowing what I would find but hoping desperately to prove this was elaborate deception. The radiology results arrived within hours. His right wrist showed evidence of old surgical repair, with titanium pins in exactly the configuration described in Dr. Robert Martinez's medical school records. I cross-referenced the files, comparing current X-rays with images from 1999. The fracture patterns were identical, down to microscopic details. I consulted with Dr. Martinez again, this time sharing the unusual circumstances. The patient claims to be a deceased physician, and he's providing verifiable medical details that match historical records. I need your objective assessment of his neurological status and any possible explanation for this level of cognitive function. Dr. Martinez performed comprehensive neurological testing over the next 2 days. The results were contradictory and medically inexplicable. While imaging continued to show severe brain damage throughout regions essential for memory and consciousness, the patient demonstrated perfect cognitive function, intact memory, and sophisticated medical knowledge, far exceeding what his brain tissue should support. This doesn't make sense, Dr. Martinez admitted privately. His brain scans show damage incompatible with consciousness, yet he's answering complex medical questions correctly, demonstrating perfect recall of surgical procedures, even correcting my technique when I described a particular approach to trauma surgery. It's as if his mind is functioning independently of his damaged brain tissue. Word spread quietly through the hospital staff. Other physicians began visiting patient 12C, testing his knowledge, trying to catch inconsistencies in his story. Dr. Patterson from cardiothoracic surgery reported that the patient correctly identified a rare congenital heart defect from a case description, then provided surgical recommendations that proved superior to the original treatment plan. Nurses reported strange occurrences in his room. Monitors would malfunction when he became emotional, displaying impossible readings before returning to normal. Call lights would activate without being pressed. The room temperature would fluctuate dramatically during his conversations about his death and the in-between experiences he claimed to remember. On day 7, I brought Dr. Elizabeth Hendricks, our chief psychiatrist, to evaluate the patient's mental status. She spent 3 hours conducting interviews, cognitive assessments, and psychological testing. Her report was both thorough and disturbing. Patient demonstrates no signs of psychosis, delusion, or confabulation. His memories appear genuine, detailed, and consistent with someone who lived the experiences he describes. Furthermore, Dr. Hendricks continued, his knowledge of medical procedures, hospital protocols, and specific personnel details from the 2008-2015 timeframe is encyclopedic. He correctly identified the maiden names of staff members, described the layout of the old trauma bay before renovation, and knew about policy changes that weren't widely publicized. I decided to conduct one final test. From Dr. Martinez's personnel file, I retrieved his residency evaluation forms, focusing on a specific patient case from 2011 that had been particularly challenging. Only Bobby and the attending physician had been present for the critical decision-making process in that case. "Tell me about the motorcycle accident victim in March 2011, I said, sitting across from patient 12C. "Young male, multiple trauma, you were the senior resident. What was the critical decision that saved his life?" I watched his face carefully, knowing this was information that couldn't have been obtained through any public records. Without hesitation, he described the case in perfect detail. 22-year-old male, head-on collision with a drunk driver, massive internal bleeding, ruptured spleen, grade 4 liver laceration. The attending wanted to operate immediately, but I insisted on getting a CT angiogram first. Found a pseudoaneurysm in the hepatic artery that would have caused fatal hemorrhage during surgery. He continued with specifics that made my skin crawl. We did endovascular repair first, then proceeded with exploratory surgery. The kid made a full recovery, went back to college, graduated with honors. His name was Marcus Thompson. He sent thank you cards every Christmas until I died. These details matched the case file exactly. By day 10, I was forced to confront an impossible reality. This patient possessed memories, knowledge, and personal details that belonged to my deceased colleague. Medical science had no framework for explaining his recovery from catastrophic brain injury, let alone the apparent consciousness transfer or supernatural awareness he demonstrated. That evening, I stayed late to speak with him privately. Bobby, if it's really you, I need to understand what happened. How are you here? What do you remember about dying? The question felt surreal, but I needed answers that medical science couldn't provide. He was quiet for a long time, staring out the window at the city lights. The car accident was instantaneous, he finally said. One moment I was driving home from the hospital. The next I was somewhere else. It's hard to describe in terms you'd understand. Not heaven or hell, just an in-between place. And I watched my funeral, saw you crying, wanted desperately to comfort you. I could see the living world, but couldn't interact with it. Then 3 weeks ago, I felt a pulling sensation, like being drawn through a tunnel. I found myself conscious in this damaged body, but with all my memories intact. Why this body? I asked, struggling to process what I was hearing. Why now? What's the purpose of this resurrection or possession or whatever we're calling it? The words felt absurd leaving my mouth, but I needed to understand the mechanism, the reason behind this impossible situation. I don't know, he admitted, but I feel like there's something I need to accomplish, something left unfinished. Maybe it's helping you understand that consciousness isn't limited to brain tissue, that death isn't the absolute end we believe it to be. Maybe it's just saying goodbye properly. On day 12, Dr. Martinez, I could no longer think of him as patient 12C, began showing signs of physical deterioration. His vital signs became unstable again, blood pressure dropping despite maximum medication support. The damage to his borrowed body was apparently catching up with his consciousness, whatever was sustaining his impossible awareness beginning to fade. "I'm dying again," he told me calmly during what would be our final conversation. "This body can't sustain whatever's keeping me here much longer. I can feel myself being pulled back to that in-between place. But I'm not afraid this time. I understand now that consciousness continues, just in ways we don't recognize." "Bobby, this changes everything," I said, holding his hand as his monitors showed increasingly irregular rhythms. "If consciousness can survive death, if awareness can transfer between bodies, then everything we understand about medicine, about life itself, is incomplete. How do I go back to practicing surgery, knowing what I've witnessed?" His grip weakened, but his eyes remained clear and focused. "Don't let this paralyze you, Lisa. Use it to be more compassionate, more open to possibilities beyond our current understanding. Help your patients transition with dignity, knowing that death isn't the ending we fear. Promise me you'll remember this experience." I promised, though I wasn't sure how I could possibly integrate this knowledge into my medical practice. At 3:17 a.m. on February 24th, Dr. Robert Martinez died for the second time. His monitors showed the familiar flatline pattern, but this time there was no attempt at resuscitation. His consciousness had already departed, returning to whatever realm exists beyond our physical understanding. The next morning, his body had vanished from the morgue. Security footage showed no one entering or leaving the area. The morgue attendant found only an empty gurney and a hospital gown. No administrative records of the transfer existed. Patient 12C had simply ceased to exist in our documentation system, as if he had never been admitted. I requested a meeting with hospital administration to report the unusual circumstances of this case. Dr. Williams, our chief medical officer, listened politely, but dismissed my account as stress-related delusions. "Dr. Wong, you've been working too many hours. Perhaps you should consider taking some time off. Patient 12C was transferred to long-term care facility per family request." No such transfer had occurred. I checked every long-term care facility in the region, but none had records of receiving a patient matching his description. Dr. Martinez claimed no memory of treating the patient, despite his detailed consultation notes. Dr. Hendrick's psychiatric evaluation had disappeared from the medical record system entirely. The X-rays showing evidence of Bobby's old wrist fracture were gone from radiology archives. The medical school records I had cross-referenced were no longer accessible through our system. It was as if the entire case had been systematically erased, leaving only my memory as evidence that any of it had occurred. I found myself questioning my own sanity, wondering if the stress of trauma surgery had finally caused a psychological break. But then I discovered something that validated my experience. A handwritten note tucked inside my locker, in Bobby's distinctive handwriting, thanking me for believing in him and reminding me of our promise. 6 months later, I made the decision to leave trauma surgery. The experience had fundamentally altered my understanding of consciousness, death, and the limitations of medical science. I couldn't continue practicing with the same certainty I'd once possessed, knowing that our understanding of life and death was incomplete. I now work in palliative care, helping terminally ill patients transition with dignity and peace. When families struggle with the decision to withdraw life support, I share what I've learned about consciousness potentially extending beyond brain death, offering comfort without claiming absolute knowledge about what lies beyond. Sometimes, late at night in the hospital, I feel Bobby's presence, a familiar warmth, a sense of being watched over. Other staff members have reported unusual experiences in the ICU, monitors displaying impossible readings, call lights activating in empty rooms, the distinct feeling that someone is standing just outside their peripheral vision. I've documented this entire experience in a sealed file, to be opened only in the event of my death or incapacitation. Future medical professionals need to understand that consciousness may not be limited to brain tissue, that awareness can persist in ways our current science cannot explain or measure. The medical establishment will likely dismiss this account as fantasy or psychological delusion. I understand their skepticism. I would have reacted the same way 6 months ago. But I know what I experienced, what I witnessed, and what I learned about the mystery of consciousness and the continuity of awareness beyond physical death. Dr. Robert Martinez taught me that death is not the absolute ending we fear, that consciousness exists independently of brain tissue, and that love and connection can transcend the boundaries between life and death. These lessons have made me a more compassionate physician and a more complete human being, forever changed by my impossible patient. In quiet moments, I still wonder about that in-between place Bobby described, about the mechanism that allowed his consciousness to inhabit a dying stranger's body, about the purpose behind his return. Medical science may never provide those answers, but perhaps that's not the point. Some mysteries are meant to expand our understanding rather than be solved. I continue practicing medicine with humility, knowing that our knowledge is incomplete, that consciousness remains the greatest mystery in science. Bobby's visit reminded me that healing involves more than treating physical symptoms. It requires acknowledging the spiritual dimension of human experience that transcends our current medical paradigm. His legacy lives on in every patient I help transition peacefully, knowing they journey beyond rather than simply ending.